Hey, Dr. Larsen here. I have Alex that just came in with some hip trouble. Go ahead and point to it where it is. Right in the back side of the bone on his right side, so this side, on the back side there. So I'm testing him out, figuring out what's going on. And I want to show what I found on him. So go ahead and lay in your stomach. So the first step is figuring out which muscles aren't working right. And we're going to check his gluteus maximus here, the big muscles, the butt muscles right now. And I'll have him do this. Push up right here. And they're very weak. Now this is the left side. He came in with right side hip pain. Bend that a little bit. Here you go. Push up right here. And that side's weak as well. Both sides are weak. Go ahead and flip over. And he's generous enough to let us film him today. Go ahead and push out here to the side. This is a gluteus medius muscle, another glute muscle. That's weak as well. Push out to the side here. The other side's weak. So he has the problem both sides. He's not just one. Mom over here asked the question, is it due to him sliding because he plays college baseball? And partly. But there's usually a weakness underlying the whole pattern that's causing him to only express it on one side. So he slides more so on this side. That's why it tends to show up on that side. If you had both shoulders had a problem or a weakness, like by muscle testing, but he's right-handed, it would show up on the right side, where it wouldn't show up on the left side so much. So I just want to show a couple muscles here. Push up and out right here. Now this one's strong. Push up and out there. We'll check the piriformis muscle, bend that, and you're going to twist that way. I'm going to twist this way. Another pelvis muscle, really, really weak. This is the right side. We'll check the left side too. Twist here, and that one's really weak. So you would think that it's a pelvis problem only, but what I find in most of my patients is that it's actually usually up in the skull somewhere. It could be a tooth. It could be a cranial problem. Now, he has a history of about 2 years ago, you fell off a truck, right?
Yeah.
Back of a truck? And he smacked his head back here. Now, I worked on him then, but I've developed some more things and learned some more things that makes me suspect that maybe it's not totally corrected inside of there, inside of his skull. So it's creating tension on the spinal cord all the way down, unstabilizing the pelvis. So what I'm going to have him do is go ahead and just pinch your nose. He's going to breathe in through his mouth and hold it, and I'm going to recheck the muscles again. So go ahead and breathe in through your mouth, hold that, and push out here. And it gets really strong. I mean, he's a big, strong guy. Go ahead and breathe again. Go ahead and take that off and breathe. Go face down, and we'll check that glute max again. So we're going to do the same thing here. We know that this muscle is weak. We'll just use one side or the other. Push up right here. And it's really weak. It's a very strong muscle too. So go ahead and try to breathe in mainly through your mouth. And then hold it in when you're ready and push up here. And now I can really crank on this muscle and push. He's got a lot of power here. So it's suggesting that he has some cranial tension inside of here. For those of you who don't know, the skull bones move. All of these move. This is very, very important. So he had a head trauma to the back of the head, and it destabilizes pretty much every single bone inside of there. These bones definitely have to move. So I'm going to do the treatment on him, and then we'll come back and we'll recheck. So we'll come back and recheck. See if we got it all. Push out to the side right here. And that's strong. Push out to the side. And that's strong. Bend this. Twist here. You're going to twist that way. And that's solid as a rock. Whereas before, that was really, really weak. Flip on your stomach. We'll check the glute max again. Bend that. Push up right here. And I can really crank on that. Now, one of the tests for this is for him to get up and walk around a little bit, and then if he comes back and it's weak again, we know that we have missed something. So go ahead and stand up and walk around a little bit. And then go ahead and lay back down.
Back or?
Go face down. And we'll see. Push up here. And it's very, very strong there. Lay in your back. Push out to the side here. And that one's strong too. And there we have it. We have an uncorrected cranial fault was part of the problem. And we'll see how he progresses from there. I might have to do some direct work right on the hip as well, but that way you guys can see the cranial problems and how a lot of issues stem from problems away from where you think they do.